Thank you for joining. We are going to talk about avoiding dehydration. We're going to talk about electrolyte supplementation in addition to basic recognition and treatment of heat-related illnesses. And we've added quite a bit of on-the-ground context as well. But we might not be able to dive super deep into each one, as this training is normally about an hour and a half. But as mentioned, please feel free to put your questions in the chat and I will stop periodically to answer those. My name is Bethany Bogasel-Kauter. I'm an epidemiologist and direct our research and public health programs here at the National Center for Farmworker Health. We are based in Texas, and we are primarily a capacity building organization, and we work really closely with health centers, with community-based organizations that serve farm workers, as well as with employers and farm workers themselves. So today we're going to talk a little bit about heat stress and sort of the range of heat-related illnesses and what to do in different situations. We're also going to talk about really important prevention measures in terms of hydration and electrolytes. This is something that not a lot of workers get education about. And we're also going to talk about some concerns we have regarding chronic health issues due to heat stress and dehydration. So just briefly, probably most of us know this, but folks working in the ag, forestry, and fishing industry are the most likely to die from heat-related illnesses in the workplace. Men are more likely to die from the heat than women in the workplace. This is probably largely just because of the industries and the jobs and sort of the gender breakdown of those. We know that age is not, in heat-related fatalities, age is not really a significant risk factor, and that's a misperception that a lot of people have. We see a lot of young men in their 20s who die from heat in the workplace. Most of these deaths in the US occur in July, and most of the time they happen in the afternoon. And the thing to know here is that most workers who end up dying from a heat-related illness die on the day they got sick. So these are really fast-moving emergencies, and we often need to take really quick action once we recognize any signs or symptoms. So let's go over a few of these basics about recognizing heat-related illnesses and how to treat them. So first is this term heat stress. And heat stress is not an illness, it's a state. So it's what happens when your body has excess heat, right? Our normal body temperature as humans is between 97 and 99 degrees Fahrenheit. Once it goes over that, your body is experiencing heat stress. And that can be because there's a hot environment. It can be because you're doing intense physical labor and producing heat that way. It can also happen when you have a high fever or all of those things going on. We have a relationship between heat stress, having excess heat in the body, being dehydrated, and experiencing a heat-related illness. So basically what I've seen is that a lot of workers are starting the day dehydrated. This makes their bodies basically less adaptable and less able to tolerate the heat. So those two things combined can make them more vulnerable to experiencing heat-related illnesses. Another interesting thing that we know from basically exercise and military science is that when people are more accustomed to the heat, they're more acclimatized, they sweat more. So it's kind of a funny thing that people who are actually used to working in the heat sweat more and have a greater need to replace fluids and electrolytes to avoid getting sick. The other thing too is that when we have electrolyte imbalances, this can lead us to being dehydrated. And if we're dehydrated, we can have electrolyte imbalances. So there's a lot of sort of feedback loops that go on in this with workers. So heat-related illnesses, these are really on kind of a spectrum, and they start from, pretty minor things that can be handled on the farm to things that need medical attention right away. So on the less severe end, we have heat rashes and heat cramps. Probably most of us have had heat cramps at some point from doing exercise or from running around the playground as a kid at school. Heat rashes, you may have seen those that can show up on, people's chest or neck or back or arms or their belly, and can kind of look different in different people. These things heat cramps and heat rashes, you don't necessarily need to seek medical attention for these things. The thing to do if a worker is experiencing a heat rash or heat cramps is to get them into the shade or an air-conditioned building or, an air-conditioned vehicle potentially, and have them drink water with electrolyte solutions. A really good way is to water down Gatorade. Straight Gatorade has a lot of sugar, but if you water down Gatorade, 1 part water, 2 parts water to 1 part Gatorade, that's a good solution mix of electrolytes for workers. So drinking that should help. If they have a heat rash, then you would want to get them into dry clothes. Keeping the skin dry is important to avoid aggravating a heat rash. So most of the time, these cramps will subside fairly quickly. If the cramps don't go away, especially if they last for an hour or more, you would want to seek medical attention because it can indicate that the worker isn't able to regulate their body temperature. Heat rashes can last for a couple days, so if it's only a heat rash without cramps, it's not as much of a concern. Now, when we start to get more concerned and when medical attention potentially needs to be involved is when we see these things showing up in workers. So if they're dizzy or lightheaded, if they faint, they might pass out and then regain consciousness very quickly. If they have headaches, nausea, or vomiting, if they become irritable, or if they notice that they are urinating less or have an increased thirst level, all of these things are indicators that the heat-related illness has become more severe. What needs to happen now is that it's very likely that if these symptoms are showing up, the worker does need medical attention, especially if they have a combination of these symptoms. So if they're having a headache and nausea, or any other combination of things, that would be really concerning. Fainting is also really concerning. Even if they did regain consciousness quickly, you would want to get that worker to medical care. In the meantime, while you're waiting, you can get the worker to a cooler area in the shade or in air conditioning. You'd want to remove any clothes they don't need, like their socks and shoes, and encourage them to sip water slowly and never leave this worker alone. This worker should not be left on their own. They should always have someone watching them and monitoring to see if their symptoms are getting better or getting worse or just persisting. Yeah. Now, something to note here, in the field, I've seen if workers only have one of these symptoms, so for example, they feel nauseous, nothing else is wrong. If they have a headache, nothing else is wrong. It can be difficult to convince, either the crew leader or contractor that the worker needs medical care, or at times it can be difficult to convince the worker that they need medical care. So, messaging here and that type of scenario is that it is better to be safe than sorry, since these things can move really quickly. And in general, employers on the farm, they should have a policy that would trigger medical care if a worker had any of these symptoms. And everyone on the farm should be trained in recognizing those symptoms and how to seek medical care. Now, if the worker is absolutely refusing medical care, which does happen, what you would want to do is get them to a cooler area in the shade or AC and have them drink water for 30 minutes or so. After that, if the headache is gone, I would recommend the worker be sent home to rest for the rest of the day. If that's not plausible in the situation, they've been resting, they've been drinking water, and the symptoms are gone, then I would keep an eye on that worker the rest of the day, but it's a little less concerning if the symptoms have subsided. If they're still having symptoms after half an hour of resting and drinking water, or those symptoms get worse, that worker really needs medical care. And at that point, it really shouldn't be an option. They really do need to go see a physician. All right, emergencies. These things are indicators that a heat stroke might be occurring, and that is an emergency, a 911 type emergency. So these things include passing out. So they might have fainted and not regained consciousness or taken a while to regain consciousness. It also includes the worker acting really confused or acting really differently. Sometimes workers can, get kind of lost. They might be confused about how to do a task that they normally do. They may become angry, things like that. You'll also see some workers will have slurred speech. And these two things combined, so altered behavior, confusion, slurred speech, a lot of times workers that can be mistaken for being inebriated or on some other type of substance. So it's really careful. We have to be really careful and train workers and contractors well to recognize things and recognize this, especially in the context of working. So we do see workers, get made fun of and things like that. But this is really a life-threatening emergency if, somebody is experiencing these symptoms during the workday or after a long, hot workday. The other thing would be a high body temperature. So I always encourage employers especially to keep just a cheap, oral thermometer around that workers can access easily, because in a lot of the heat fatality cases that we see, the body temperature was between 103 and 107. So if workers really have anything over 99 degrees, you want to cool their bodies. So it's great if you can check the body temperature to understand how much of an emergency it is. And then lastly, workers that are having a heat stroke, they can be either sweating profusely in order to try and cool off, or they may have stopped sweating and their skin is dry and hot. And so this kind of depends on their hydration level. So if a worker has any of those symptoms, you would need to call 911 and you would need to take action while waiting for paramedics to arrive. So the goal here is to cool the worker off as fast as possible. So some farms might have a walk-in cooler. Getting the worker into a walk-in cooler is a good idea. If not, then sometimes it's possible to immerse the worker in cool water. That can really help as long as there's no risk of drowning. If neither of those things are an option, you would want to get them in the shade or into an air-conditioned building, and then basically start fanning them, put ice packs on them, cold rags, anything to help lower the body temperature. And you'd especially want to focus on putting rags and things on the head and the chest area to lower their core body temperature. And again, this worker should not be left alone. So something to note here, especially for folks who live in northern climates, a lot of our heat-related fatalities in the US, they occur when it's really not all that hot out. A lot of them occur when the heat index is in the 80s. So obviously, temperatures of 90 or 100 or 110 are dangerous, but workers do also experience quite a bit of risk when temperatures are just in the 80s. Another factor here to note, especially for farm workers, is how acclimatized they are to the heat. So domestic workers that live in that place year round, they need time to adjust as temperatures rise. They need reduced work hours and more frequent rest breaks. A major concern that we're seeing is, with H2A workers who are coming from really cool mountainous climates in Mexico or Central America, and then they're coming to the US to a new climate and they have to start work right away. And sort of the added layer with H2A workers is that they're often on a bus for multiple days. So, 2, 3, 4, 5 days on a bus. A lot of those buses don't have bathrooms, and workers will deliberately limit their food and water intake because there's no bathrooms on the bus. So I believe that a lot of these H-2A workers are arriving to the US really dehydrated, and then they're being put to work right away without a period to rehydrate, to acclimatize. And, we saw that happen in the death of an H-2A worker last year in Florida, on their first or second day of work. So there is a big risk, I think, for those workers that are being dropped into these hot climates. I'm not going to go into this story, but I would encourage folks to read it. This is a good one, I think, to share with employers, because I think many employers are often under the impression that workers who are vulnerable to heat-related illnesses are vulnerable because they're inexperienced, because they're obese, because they, have other chronic conditions, etc. But the story of Mr. Cruz Beltran really highlights how even experienced farm workers who are acclimatized and healthy are at risk of, of heat-related fatalities and illnesses. So he actually lived in Arizona and was a corn detasseler and died in Nebraska. He was alone, and it took them several days to find where he was in the fields. Okay. So let's talk about hydration, and I'm curious if folks have comments about this one. These are some photos from a heat stress study that I did with construction workers a couple of years ago. And I like to use these photos when educating workers. So, a good way they can monitor their own hydration status is by checking the color of their urine. This is hard to do in the field, but they can certainly do it at home, generally, by looking at the color of the urine in the toilet. And you can use these photos to kind of educate workers. So you want to, let me jump ahead to this scale, actually, and I'll come back to this. So, if it's very light, if it's almost clear, the urine, then they might be drinking a bit too much water, actually, and might need to be a little more careful about their salt intake and things like that. But basically, pale yellow, kind of medium yellow, that's good. Darker yellow indicates that they're dehydrated. I also see brown urine, and this is a really big concern. Brown urine can indicate a lot of things. My biggest concern with outdoor workers is that they might be experiencing rhabdomyolysis, which is when workers are working so hard and they're so dehydrated, their muscle fibers are breaking down, and you're seeing it show up in the urine. So let me show you a picture here. So you can see here this brown urine, it kind of looks like tea or a soda. And we believe that this worker was experiencing rhabdomyolysis, and he was experiencing a heat-related illness when I took this sample. But I'm curious what y'all think. Which of these three, you can do one, two, or all three, which of these do you think of these urine samples the worker was severely dehydrated? You can put in the chat your thoughts. Yeah, so some folks are saying number three. So all three of these urine samples, the worker was severely dehydrated. So that dark yellow on the left under number one, that worker was also severely dehydrated. These back here, these two were hydrated, and the one on the left, that person was kind of mildly dehydrated. Okay. So when we get severely dehydrated, and we see workers doing this, so workers that are starting the day dehydrated, they're often getting more dehydrated during the workday, and they have very little time to sort of catch up on fluid intake at the end of the day. Something that researchers are starting to see, we need more work done on this, but basically we think that they're experiencing a kidney injury. That's a short-term injury. And if this happens, multiple times over time, it can really increase their risk of chronic kidney disease. The interpreter, I think, needs to catch up. So I'll wait a moment. And then we already kind of covered rhabdomyolysis. It might, if you're interacting with workers very often, it might be interesting to ask them if they have seen their urine brown. I've heard this really often from workers, and they, not a lot of workers understand the risks. Urine can be brown for other reasons too, but if they're working really hard in the heat, that's a big concern. All right. So tips for staying hydrated. And Abigail put a resource in the chat that provides this information for workers. We recommend drinking about half a liter of water before starting work. And then a lot of workers will need around a liter per hour. This can vary. Some workers might just need half a liter. Some workers might need more like 2 liters an hour. It kind of depends. If they are drinking a lot, like a liter or more, they're going to want to be sure to also be drinking electrolyte solutions. So at the very least, adding a little salt to the water can help. You can use the watered down Gatorade that I mentioned. Workers can also make a homemade swiddle. Obviously, there's potassium and magnesium and other electrolytes, but adding a little salt and sugar to the water can really help the workers feel better and make sure that they don't, that their salt level doesn't get too low if they're drinking a lot of water. There's other foods that we recommend that are really good for replacing electrolytes, especially like potassium and magnesium. So some sort of culturally acceptable ones would include watermelon. I tell workers, like, put some tahine on your watermelon. That's a great electrolyte snack. Avocado, queso fresco, yogurt, bone broth is really great. Caldos with bone broth, bananas, and yeah, pickle juice even. If people like to drink pickle juice, that can also be a good electrolyte supplement. People who are on dialysis will often drink pickle juice to help with this. A note about salt intake: if you, are used to educating workers about hypertension and diabetes and things like that, we're very used to telling people to limit their salt intake. But these workers, if they're sweating a lot, they really do need salt, especially if they're just eating foods like queso fresco and things like that. They're probably not going to overdo it. And if they follow the guidance on the homemade suero or drinking watered down Gatorade, that's going to help them, because they're going to feel really sick if their salt levels get too low. Some workers are going to have other chronic conditions like hypertension. In that case, it might be best to seek the advice of a nutritionist and explain the situation and kind of come up with some options for workers if a lot of workers have high blood pressure and are losing a lot of fluids while working. Probably most of us know this: alcohol and caffeine dehydrate you because they make you urinate more often. So it's good to talk to workers about limiting alcohol use during the season. And if they are drinking alcohol, really emphasizing the importance of also drinking water and the electrolyte solutions. All right. So let's talk about a few chronic health issues. And I'm curious if y'all have heard of these come up, of these chronic health conditions. So there's been really a substantial amount of research happening in Asia and Latin America about this, not so much in the US quite yet. But what our concern is chronic kidney disease of non-traditional cause. So most times globally, chronic kidney disease is caused by diabetes or high blood pressure. But what we've been seeing in the last 20 years is a lot of people getting chronic kidney disease that don't have either of those conditions. They have no other explainable cause for it. So this type of chronic kidney disease is now the leading cause of death for men in El Salvador and Nicaragua, and we're starting to observe it in Guatemala and Mexico in the US. We still need more research, but there's a lot of evidence that, for whatever reason, being in a physically demanding job, being dehydrated, and being overheated for long stretches of time is really putting these guys' kidneys at risk of having chronic kidney disease. So we see this kind of develop over years of exposure, and it gets really tricky here in the United States because you can slow down the progression of kidney disease, but once you get to the end stage, you need dialysis or you need a transplant. And accessing that type of care as an undocumented person in the US is extremely challenging. I know here in Texas, we have only 3 counties where the county will pay for dialysis for undocumented immigrants. All the other counties, they're just kind of out of luck and have to use the emergency room. So it's really an issue that we want to prevent in workers from ever getting chronic kidney disease. And we really want to keep that from getting to the end stage if they do get it. There's some other interesting research emerging about being dehydrated and being exposed to the heat. There's some kind of early research that is showing that that type of exposure can increase someone's risk of diabetes or metabolic syndrome. And we see this in farm workers a lot, right? High blood pressure, high cholesterol, obesity around the abdominal area, and elevated blood sugar. So this is really a concern that some conditions of work might potentially be putting people at higher risk for experiencing all these other conditions. There's also, and I've heard this one a lot from workers, outdoor workers, is having kidney stones. And that can happen from chronic dehydration. And that's very, very painful for workers. I've talked to a lot of outdoor workers who are experiencing kidney stones once or twice a month, which is very frequent. All right, we'll talk about prevention. Prevention is simple, so simple. That's the great thing about this. We can avoid all of this really easily. Working with employers and contractors to make water and shade easy to access in the field, right? Oftentimes we see that there is shade, but it's far away. They have to walk down a long row. We want to make shade mobile with the workers as much as possible. And if workers are acclimatizing, or if the temperature starts getting hot, over 85, 90 degrees, then workers really need mandatory rest breaks, especially if they're piece rate and feeling a lot of pressure to move quickly. Really need to build in rest breaks in the shade for workers. Having a buddy system is really essential to this too, because in so many of the fatal cases, the worker was alone. And once they got so sick, they lose their decision-making abilities. So having a buddy system where, workers are paired up throughout the season, they get to know each other, and they can kind of recognize signs in each other and advocate for rest or medical care. That's a really essential component to preventing heat-related illnesses among farm workers. Another really great idea that I've seen some farms do is have a crop row marking system. So, and this is really important in the taller crops like tomatoes or corn. So workers might not be working in pairs in the same row. They might have their own row, but the worker will, put a stake at the end of the row where they're working, and then they move it once they move to another row so that everybody knows right where they are and you don't end up with cases like Mr. Beltran's where they couldn't find him for several days. And then, of course, everybody on the farm, including people in the office, including people in leadership like foremen and crew leaders, they all really need to be trained on all of these measures. And the producer needs to make sure to enforce all of those measures. These are just points to go through with an employer, just making sure that they have all of these things, that they have accessible water and shade, making sure that the crew leader is encouraging workers to drink water, and then sort of doing these like safety checks to make sure that workers aren't being, penalized or retaliated against if they do try to stop and rest. I know we had some farm workers from Georgia call us once that they were really concerned because they got overheated during the workday and took a break under a tree to rest, and the labor contractor fired them for doing that. So it does happen, and there's action we can take with OSHA to make sure those workers are protected. This is a great point to emphasize how beneficial rest breaks are to both workers and the producer. There was a really interesting study done in Nicaragua with sugarcane workers, and they gave workers camelbacks with water. They set up these mobile shade tents that move with the workers. They were resting actually for 25% of the workday. So, a 4-hour morning, an hour of that was spent resting. And the workers also got an improved machete. And what they saw was that all these reported symptoms of heat stress that workers were experiencing, especially serious ones, that all went down after they implemented this intervention. The amount of water that workers drank increased by 25%, and workers went from harvesting 5 tons to 7 tons of sugar. So even though they spent way more time resting, they were actually way more productive. And this makes sense, right? If we think about how farm workers are athletes, you don't expect athletes to perform at peak performance if you don't give them water and you don't let them rest. So it's the same thing for farm workers. If we want peak productivity, they have to take care of their bodies. This is just more info on the buddy system as a reference. And we'll talk about a couple of kind of more practical issues that come up in the field that people often don't like to talk about. You all know this, that pay structures, can really disincentivize people taking breaks. And sometimes we hear this from employers. They're like, oh, well, they don't want to take breaks. I try to get them to take breaks and they don't want to. Well, workers know that if they lose pay because they're taking a break, that really isn't a strong incentive to take a break. So I think going through that and thinking through with employers how to adjust that. There's all kinds of ways that producers could do this. So they could, they could average out potentially the time. So if they, made an extra $10 an hour in piece rate pay, and then the next hour they're taking a break and the piece rate only earned them $7, they could normalize it out to $10, or they could pay for them to take the break. There's just all kinds of ways, kind of depending on the pay structure. And I encourage employers to think through this with a worker committee to make sure that it's working for everybody, because they will be more productive if they're taking breaks. It's a smart investment to pay workers to take breaks. Outreach staff can do a lot here. I'm sure a lot of you already do these types of trainings for workers. You can also offer to help producers or contractors develop their own sort of heat emergency response plan, encouraging them, to make water, rest, and shade more accessible, and doing these regular talks with workers. I know something that was really powerful that I was able to do as part of that heat stress study was use really cheap urine dipsticks that indicate the level of hydration or dehydration. And I would show workers that I would show them that they were coming up as severely dehydrated in the morning. And when I did that education, by the end of the workday, when I took the second sample, workers were often hydrated. They had moved from severely dehydrated to hydrated status, just because they were aware of it and they were drinking water more consciously because they saw very clearly how dehydrated they were. So I think just encouraging workers and showing them, I think they are motivated to take care of themselves. It just helps sometimes to be able to stop and take the time to consider how it really is impacting their body. So that kind of feeds into this. So some key points to bring up for workers is, drinking before you're feeling really thirsty, eating those good foods that will help you replace electrolytes, doing the urine check at night and in the morning, making sure to emphasize that, if it's a darker yellow, they need more water. If it's brown, they need to go to the hospital. Using the buddy system and really encouraging workers to support each other in asking for water and rest and shade on the farm. Kate has a great question about a sample farm heat emergency plan. We do have one. I do know of one that I can send out, so I will send that after the webinar to attendees. Another thing I think after 15 years of talking to outdoor workers about this, I think that reminding workers that no job is worth their life is really important. I think it's an important sort of piece of information to empower workers because so often, workers can really get kind of beaten down by this narrative that, they're here to work and they need to work as hard as possible and they're just going to burn through their body and that's that. But really, I started hearing this line from workers that had been severely injured, and they just said over and over again, like, I wish that I had just lost my job instead of lose a limb. So I think it is an important point, and there's economic realities, there's all kinds of realities workers face, but sometimes it is about a life or death issue, and I think it's okay to remind folks of that sometimes. So you can also, empower them with this type of knowledge that they can implement and give them resources when the employer isn't supportive. Organizations now can do third-party OSHA reporting if a worker is concerned about about retaliation. OSHA's also done a lot in terms of whistleblower protections and U visas and things like that for workers. So right now, things may change, but at least right now, I think the climate is, pretty good for workers to report things to OSHA. One other note here, and this can be a little controversial, and it's really going to vary from worker to worker. But I think especially in farms where it's mostly men or all men, it can be hard. I think men have a harder time often kind of staying in tune with their body. There's also peer pressure to avoid taking a break on some farms. And so that peer influence can play a really big role in how often people take breaks and how often people drink water. So again, I really like this analogy of comparing farm workers to athletes because we do know many farm workers are burning hundreds of calories an hour. And so they're burning through 3 or 4 or 5,000 calories a day, just like an athlete would. And so kind of emphasizing this, like you're doing really amazing work with your body and it's important to take care of it. And then encouraging that kind of talk among peers, among men. Another issue that we've seen that can go beyond this just sort of culture of not taking a break is that some people who have experienced a lot of trauma really do have a really hard time kind of coming back to their body and feeling what's in their body. And they've often kind of learned to disassociate, especially when their body is in a lot of pain or they're really uncomfortable. And dissociating happens when people kind of disconnect from the present moment, um, like zoning out. And this is really common in folks that have PTSD. And it can help you. It can help you not feel as much pain, but it can also make it so that workers aren't as aware of what's happening, of worsening symptoms for heat-related illnesses and things like that. So this will be different in every community, and every outreach worker can do different things. But I think if you observe this happening with workers who you are serving, you might observe them blowing off physical discomfort or not really recognizing it. Certain grounding techniques can actually be really helpful for this and teaching workers this. And it can feel like a little silly, I think, to both the teacher and to the workers at first, but it often is really, really helpful. So these are just some different grounding techniques that people use. There's many others. One that I really like that people can do while they're working is mentally noting 5 things they see, 4 things they hear, 3 things that they can touch, 2 things that they can smell, and 1 thing that they can taste, or whatever combo of that. And that really helps people notice their surroundings and stay in the present moment, and kind of as part of that, they're able to come back to their bodies and notice what's happening in their body. Okay, so a little bit about labor contractors and employers. Again, emphasizing the productivity benefits, emphasizing this athlete comparison can be really useful when talking to employers and contractors. And sometimes, just saying, like, let's try it for a week and see how it goes, see if workers are able to maintain or even improve productivity if they're well hydrated, well fed, and rested. um, this is some more information. Some of these data can be helpful in educating employers and contractors just about the demands of farm labor on someone's body. So this is the citation for that study that I mentioned. Farm workers in the Midwest burning, between about 3,000 and 5,000 calories per day just at work. So this is on top of, your normal stuff you're doing before and after work. Many of you, I'm sure, as I mentioned, have already developed relationships with employers to give different heat-related illness trainings. You can also offer, to train the supervisors. And we encourage this to be a collaborative process, because implementing these measures really is just a win-win for everyone. There's no loser if workers are getting rest breaks and shade. Getting these guys, getting especially crew leaders on board is really critical. So we've all seen that disconnect, I'm sure, where the producer is on board. The farm owner has good protocols, is on board, but things might start to break down with middle management or crew leaders that are just managing a crew of 5 or 6 guys. So it's really important to make sure that the education and enforcement is happening on all the levels. Okay, great. Now, I have a scenario for you guys, and I'm so glad that we have the time to do this scenario. So you can type in the chat your thoughts to this question, or you can raise your hand and we'll unmute you if you'd like to talk about it. But I'd like to know your thoughts on what to do in this scenario. So let's say you're doing outreach and you get to a farm. It's in the afternoon around 4 p.m. One of the workers is kind of stumbling around and his speech is slurred. It's 87 degrees outside. What would you do in that scenario?
We have an attendee who raised their hand. I'm going to allow them to talk. All right, Maria, you're allowed to unmute.
Sí, buenos días o buenas tardes, buenas tardes. Bueno, lo que yo le haría, iba a buscar otro compañero que estuviera más cerca para no dejar esa persona se siente mal. Y llamar pues 911 para que vengan más pronto. Si estamos más personas, podemos estar otro en la calle para que esté diciendo los ambulancias o los bomberos dónde pueden llegar más pronto, porque a veces lo llamamos y no le damos muy bien la dirección. Es mejor estar afuera esperándolos para que le diga dónde está la persona.
Perfecto, perfecto, sí. Tener a alguien que va a estar con él y llamar 911. Eso es perfecto. Y tener también personas esperando la ambulancia, porque sí, a veces es difícil encontrar en dónde necesitan ir exactamente. Great. And Xavier said to also have him sit in the shade, give him water, call the crew leader. Those could be further actions. And the other thing to remember with these cases is that if he's confused and has slurred speech, this is could likely be a heat stroke. And so you would want to cool the worker's body off as fast as possible. And the ways to do that were getting into a walk-in cooler, getting immersed in cool water, or putting ice packs and cool rags on the worker's body and fanning them. And you'd want to take off extra clothes too, like shoes and socks. I think that I could check the recommendations. I think for lower severity heat-related illnesses, it is recommended to give water. I think if you suspect a heat stroke, it's not recommended to give water or very, very little. And I think the concern there is about the worker losing consciousness. So maybe tiny amounts of water in that case, but you wouldn't want to give them a lot if they were that sick. Okay. So I have another question for you all. What are some of the ways that you have found that are the best ways, to talk to men and with men about their health, about observing their own limitations and things like that? Again, you can raise your hand if you'd like to speak, or you can put it in the chat. And yes, Xavier mentioned putting cool water on the chest is important. Yeah, so if they can't be immersed in water, then putting the rags or ice packs on their chest, their belly, their head, that would all help lower their core body temperature. So great point. I'll give folks another minute here. Maybe people haven't had this problem in speaking with men. Maybe they're really proactive. I had one of my grandfathers, we joked because he hated going to the doctor and he ignored any and all health problems that he had, and including dental ones. And if he got a bad cavity, he would take a wood file and file down his tooth rather than go to the dentist. So I know this has been an issue with many, excuse me, many workers I've spoken with and in my own family. All right, I know we're about done, so I'm going to jump ahead, but if you have a thought, feel free to put it in the chat. We have a few resources, so this is what Abigail had placed in the chat. This flyer right now, we have it in English and Spanish. If you print it out, it's a postcard size, so workers can, stick it easily in their back pocket. And it gives guidance on how much water to drink, foods they can eat, and then it has that urine color chart with both the graphic and the photos to help workers monitor the color of their urine. There are other resources. NIOSH has quite a few resources on this. OSHA does as well. I think the farm plan that I'm thinking of is from OSHA. that Kate had asked about. We also have some other resources. We have kind of a different variation of those recommendations on electrolytes. That's a full page flyer instead of a postcard. And then we also have a curriculum that we developed for CHWs to use to talk to workers about heat stress and also sun protection for their skin. And we have like a flip chart and things like that that are available. Call for Health is another resource we have if you work with workers who are very migratory. We have a WhatsApp line that workers can contact if they need help finding healthcare resources in a new location, if they move out of the community that you serve. So those are my slides. I want to bring up Xavier. He brought up a really good point, and said that he makes it a point to talk to men about the reason they're working, which most times is for their families. And he asked them that, you know, if you're not working because you're sick, then who's going to provide for the family? So it is another good point that can give workers pause. So thank you for sharing, Xavier. I'm going to check the questions. I think they've all been answered. Well, wonderful. If you all have any other questions, we'll wait on the line for a few more minutes. You're also welcome to email them as well. I'll put my email in the chat right now. So thank you for participating and sharing some of your experiences.